I was 26 weeks pregnant the day after Thanksgiving. It was my first baby. They said I had toxemia. She was born 2 days later and weighed only 1 pound 13 ounces. She's doing really good.
Pediatric clinics see patients every day for routine care and also for specialty care, like heart problems and cancer. Trish is one of 12 nurse practitioners who work in pediatrics.
I've seen things here I'm sure most pediatricians have never seen. Many of the families also use the clinic for their routine child care, which makes for a nice balance. This little guy has asthma, and I'm checking him out. I see him, his sister, and brother whenever they have a problem.
Janet started complaining of headaches. They did a blood test and found leukemia. The doctor started chemotherapy, and about a week later, Janet started complaining of bad stomach pain. They found she had a ruptured appendix.
The main goal of Child Life Services is to provide a place for patients and families to cope with their hospitalization, to deal with illness, and to provide a sense of normalization. Many children feel anxious or afraid when they're undergoing procedures, so our role is to provide coping techniques. And we also provide things like Disneyland trips, birthday parties, trick-or-treating for Halloween, and all the other types of activities that a child would experience outside of the hospital.
Josue's parents recall what happened when he accidentally swallowed lye.
He tried to get the bite for the little brother, and when he opened, he see the bottle. We keep a strong cleaning fluid in the Gatorade bottle. He drink it because he's thirsty. And I called to the paramedic, and they come in and they take it to the Harbor Hospital.
Josue has damaged his esophagus, and the Harbor Hospital team works on the problem. Surgeons place a tube in his stomach so he can be fed. They dilate the scarred esophagus every 4 to 6 weeks so Josue can eat. Even with discussion and sedation, Josue is terrified each time and says he's afraid he won't wake up. The dilations aren't working, and the team decides to recommend replacing Josue's esophagus with a piece of his intestine. The social worker explains the plan to Josue's parents in their native Spanish. They agree, and the surgery goes well. 6 weeks later, Josue can eat everything. What's your favorite food, Josue?
I love my mama's spaghetti.
Family Practice is the third largest training program at Harbor. The Family Medicine Group runs 2 large health centers in the community and provides about 60,000 outpatient visits a year to its patients. Dr. Terry Navarez talks about some of the family medicine's hospital work.
Here, we were going over with the patient, and since the patient was monolingual Spanish, just confirming that the patient understood why she was in the hospital. The delivery sequence that you do see is a patient that we've seen in our Wilmington clinic. We're explaining to the patient what's going on with her pregnancy and explaining to her how the delivery is going to go. The next photo you'll see is actually the resident who was the continuity of care provider coming in for the delivery and follow the patient up the next 2 days while the patient's in the hospital. And they will continue to then see the baby afterwards if needed, at the 2-week or the 8-week visit.
Mr. Lee has been going to the Lomita Clinic for about 9 months. He used to go to a downtown clinic, but they found out he made $900 a month, and they said he made too much money. He has acid reflux and high blood pressure, and the doctors told him he needed a treadmill. And he asked, how did he do on the treadmill test?
You did great, Mr. Lee. Everything looks great here today.
As part of their passion for getting involved in the community, several members of the family medicine faculty started a health center at a high school with 3,000 students near the hospital. Selected students took a semester of classes. After that, they went out and taught their peers about such things as drugs, teen pregnancy, domestic violence, and sexually transmitted diseases. Here we see Dr. Puvala discussing the use of condoms.
What are some of the excuses for not using a condom? we don't have one, I can't wait, I'm too big. Always carry a condom.
Every month, on a Thursday evening, the family medicine doctors run a clinic for the homeless in a church near the hospital. This patient comes in every month to get his blood pressure and diabetes checked and to get some medicine.
This individual is very, very depressed. He has recently lost his apartment. He's on the street. This is not something that he's accustomed to. I'm really trying to help him understand how important he is, and even though it seems bleak right now, how it actually can get better for him.
So part of family medicine is that we do practice sort of the old-fashioned type of medicine, that we do still do home visits. And we really believe in family medicine about the home visit because you get to see a different aspect from the patients, from their point of view of where they live. It gives you a different perspective of what they're doing than when they just walk straight into your door. And the home visits are very satisfying and they're not hard to do.